Recent experimental work has clarified the variable roles played by arterial blood volume, stroke volume, heart rate, and most importantly, total peripheral resistance in the development of essential hypertension. Increased peripheral resistance, the primary hemodynamic abnormality in essential hypertension, is now believed to contribute significantly to the development of vascular, cardiac, and renal complications. And, as is all too well known, a sustained increase in peripheral resistance and progressive hypertension lead inexorably to structural abnormality and ultimately to failure of organ function.
Antihypertensive therapy should lower blood pressure with a minimum of side effects to ensure maximum patient compliance. Poor compliance results in poor control of hypertension. The side effects profile of Prazosin is particularly favorable. The relatively few side effects that may occur usually are seen early in treatment and are reduced or disappear on continued therapy. This profile and Prazosin's novel mode of action in lowering blood pressure have impressed many clinicians who treat hypertensive disease.
Prazosin acts to reduce total peripheral resistance and is most widely used in moderate to severe hypertension. Clinical experience to date suggests that it possesses advantages over certain established medications. Traditional vasodilators may cause fluid retention and tolerance. They often induce a reflex tachycardia, which may produce discomfort and place additional strain upon the heart. Prazosin does not elevate the resting heart rate, but permits a normal heart rate response to occur during exercise. Prazosin has not been reported to cause the development of tolerance, despite many years of use in patients with all grades of hypertension.
Prazosin may be used alone or in combination with other antihypertensive agents. Its action is particularly complementary to that of thiazide diuretics and beta blockers. Prazosin can be used in patients with gout, hyperuricemia, and diabetes, where thiazides may be contraindicated, and in patients with asthma in whom beta blockers may present problems.
For the more severely hypertensive patient, Prazosin has been shown to be a valuable adjunctive drug, as it is compatible with other antihypertensive agents, and its pressure-lowering effect is additive. Many hypertensive patients with existing renal problems are often relatively difficult to manage. Prazosin is particularly suitable for patients with varying degrees of renal involvement because it preserves cardiac output, renal perfusion, and glomerular filtration rate, and does not decrease renal plasma flow, nor increase plasma renin levels. It is noteworthy that Prazosin has been used safely in patients with renal failure. As for hypertensive patients in congestive heart failure, the use of Prazosin may help to improve cardiac performance. By dilating peripheral resistance vessels, it reduces aortic impedance and ventricular afterload. And by dilating capacitance vessels, it reduces cardiac preload. These reductions of cardiac preload and afterload may improve myocardial contractility by mechanisms which have now been thoroughly described in the literature. In overall clinical experience, then, Prazosin has proven to be a remarkably versatile antihypertensive agent. As with any such drug, best results are obtained through careful and adequate dose titration and patient monitoring at the outset of treatment. It is useful in all grades of severity of hypertension, alone or in combination with thiazide diuretics and/or beta blockers, especially in patients whose hypertensive disease has already resulted in progressively adverse hemodynamic changes. With the addition of Prazosin to the medications already available, clinicians more than ever before can be confident that effective, well-tolerated antihypertensive therapy may prolong life and spare burdensome complications.